So welcome to the Breast Cancer Rehabilitation and Wellness Summit. My name is Denise Stewart, and I'm going to slow down because I go too fast sometimes. I'm going to be interviewing Samantha Clutton this morning. In fact, I'm not interviewing her. Sam's actually got a presentation on managing relationships after breast cancer. Sam is a clinical psychologist, and she's got some ideas for us to be able to understand what's going on and also some strategies on how we can cope better. Welcome, Sam.
Thank you, Denise.
So we will pre-warn everybody, Sam is seriously jet lagged, but let's see how this goes. Over to you, Sam.
Thank you. Thanks, Denise. So yeah, my presentation today is around how you might help couples better adjust to a diagnosis of breast cancer. What is the impact of breast cancer psychologically? Well, I think a lot of you already know that patients experience very high distress, especially at the time of diagnosis. The distress levels tend to spike again at the commencement of treatment, and surprisingly to some, following the end of treatment. Now, this distress is often very unfamiliar for women. They experience a huge amount of anxiety, sometimes depression, anger, guilt. Often people can feel like they're going crazy. Now, although for many, this spike in distress subsides in the initial weeks post-diagnosis, and then after 12 months, it often returns to more normal levels. There are a significant minority of women, around 30%, who go on to experience persistent clinical distress, anxiety, depression, trauma. Now, most women cite their partners as their primary coping resource. And in fact, patients who are partnered, who are married or in a stable relationship, tend to report better emotional and health outcomes, so less likely to be depressed, more likely to opt for definitive treatment, and in fact, higher survival. So partners are an incredible resource. However, breast cancer has an impact on partners as well. So when we look at the research, we see that partners also experience very high distress, especially around the time that their wife or partner is diagnosed with breast cancer. And that will often subside. In men, the distress, they tend not to self-report distress in the same way as women, and tend to report that that has subsided fairly quickly after a diagnosis, or after the initial trauma of diagnosis has settled down. However, their distress is higher and remains higher if the patient is also distressed. Now, also, and it depends on a number of factors here, if the burden on the patient is really quite significant, as it is for many women who have bad reactions to treatment or who have more advanced breast cancer, where the partner is providing more of that caregiver role, in fact, there is a significantly increased risk, longer term too, of higher anxiety, depression, longer term medical problems, and mortality. So in terms of the impact then of breast cancer diagnosis and treatment on the couple relationship, inevitably, it places great strain on relationships. And even though many people report that relationships are strengthened as a result of going through breast cancer together, even for those happy couples, there are periods of great strain. But for some, there's irreparable damage. And in fact, the research varies in terms of the statistics that they report on instance of separation and breakdown. Some report that it's significantly higher in couples following a breast cancer diagnosis, but inevitably there is strain. So let's talk a little bit about why relationships suffer. And I talk about this because that helps to inform what we can do as health professionals to help or address some of the issues that might make it better for the patient and her partner and the couple. So Well, there's high levels of individual stress. And as we know, when we're stressed, then we're less likely to be the partner that we're used to being with our partner. There are role changes. So particularly for the partner, if his wife or partner was employed, he's taking on more of that financial burden. If she has to sort of give up work for a period of time, he's often taking on more of the household responsibilities and often taking on perhaps more child caring, perhaps providing a conduit for information about his partner. So there's sort of navigating those role changes. Oftentimes too, and even for those of us who feel like we're really in touch with our thoughts and feelings, when you're dealing with feelings associated with being diagnosed with cancer, it's really difficult to acknowledge those thoughts and feelings to yourself. And even if you can acknowledge them to yourself, what we find is often patients and partners avoid talking to their partner about those difficult thoughts and feelings. And that's because often they want to protect their partner. They feel as if they talk about how they're feeling or ask their partner how she's feeling and she becomes upset, then that's the wrong thing, that's a bad thing to do. So I better stay positive, I better not talk about it, I better help to distract her. Now, the other I guess, significant factor is sometimes there is a mismatch of coping strategies between the patient and her partner. So it might be that at one point she's wanting to really acknowledge feelings or have a good cry or talk about what's going on, and her partner might be going through a period where he feels he has to cope by keeping busy, distracting himself or thinking positively, and maybe at other times he might be more able to touch feelings or talk about things, but at that particular time it's really, really difficult. And if you have that mismatch of one person wanting to talk or acknowledge or sort of connect with or process emotions and the other person really needing to think positively or distract, or then you can see where there can be a disconnect. The other reason that, and this is just very pragmatic, that relationships suffer is those little rituals of connection that might mean that we don't really need to talk as much, often disappear following a breast cancer diagnosis, and particularly during the challenges of treatment. So you might be used to having a glass of red wine after dinner and sitting down together and just sort of chilling or having a coffee, or, you know, having a bit of a natter about things on the weekend as you go for a walk together. Now, with the busyness of treatment and the fatigue and all of those demands and challenges, those little rituals of connection disappear. So not only are we perhaps not talking about how we're thinking and feeling or trying to distract ourselves, but, you know, we're not coming together in the way that we normally would due to just the sheer busyness and the fatigue and all of the other challenges of breast cancer. And frequently, very frequently, at least for a significant period of time, sexual intimacy is reduced. Women often report that desire is the first thing to go with the stress of diagnosis, but also as a result of side effects of chemotherapy and hormone therapy in particular. And sex is one way that couples can often come together to feel really connected. So we've got mismatch in couples' ways of coping, perhaps one person wanting to talk, the other person not wanting to talk, the little rituals of connection disappearing, sexual intimacy is reduced, you've got role changes, and you've got high levels of individual stress. Now, not surprisingly, that results in, inevitably for couples, increased risk of misunderstandings and conflict. It results in oftentimes partners, but also patients, feeling helpless, and helpless about how best to support their partner, who they can see is perhaps not travelling so well, but they really don't know what to do to make that better. It results in women's support needs not necessarily being optimally met, and intimacy needs not being met either. And sometimes and frequently, at least for periods of time, a sense of loneliness. So even though you're in that relationship, you can feel lonely, and there can be a sense of real disconnect. So oftentimes I see couples post the end of cancer or breast cancer treatment where they've really noticed that there's just a rift. There's a sense of not being on the same page anymore. There's increased conflicts and misunderstandings. And it's not infrequent. It's not a sign that the couple have, really poor coping. And if we get in early enough, we can often make a real difference. So let me talk about what we can do perhaps to make a difference as health professionals. What I recommend is, as often as possible, involving the partner in therapy or in discussions or in information sharing, because people are often at times traveling separate journeys. They're not coming together, not sharing information, they're not on the same page, they don't have the benefit of that additional support that that patient might be getting from that therapist or nurse, and they're relying on their partner to talk to them about what's happening, and they might not be. And so if you can involve the partner in therapy, that can be a really important first step. If you do manage to get the partner either by themselves or as part of a couple, it's great to use that opportunity to ask about how they're feeling, and then normalize any stress. Oh, it's pretty normal to feel like that. It doesn't mean you're going crazy. Lots of partners feel like that. It's not uncommon to experience these sort of feelings. Now, this is oftentimes the first opportunity that partner has had to hear about how her partner's feeling, and for her partner to stay with and sit and listen to what his partner is saying. If you can then, and related to that point above, promoting an understanding and an acceptance of those differences. So I think I'll talk a little bit about that in a moment. Then look at what you can do to optimize the support that each person is offering each other. If possible, look at ways of enhancing their coming together, their communication, encourage good common sense stress management, and ensuring they're finding that balance between individual strategies that they're using to nourish themselves, care for themselves, manage their stress, and shared activities. So balance between individual and shared activities. And if you have the scope, then look at different ways that the couple might show love and intimacy, particularly if sex has been taken off the agenda, because that is something that really fundamentally can help to repair a relationship. Okay, so I might talk a little bit now about some of the ways that I would suggest to a couple, or if I'm working with an individual, either the patient or the partner, some of the things I would say to them to help them, for a start, to accept the fact that their partner might be coping in a different way, and not to judge or prejudge how they're reacting or how they're coping. Now, you can see from those strategies, I would encourage them to accept that you're different people, and even though you feel like you might know each other better than anyone else knows you, when you're highly stressed, you barely know what you're thinking and feeling at any particular point in time. And with stress, you become completely unable to mind read in the ways that you would normally. And so our differences become really heightened when we're under stress. Now, in fact, the research shows us that there's no actually one right way to cope with cancer-related challenges. In fact, those people who do better, both partners and patients, are those who have a variety of ways of coping that they can tap into. So, if the patient says, well, my husband's, he's not coping, he's spending too much time, joking about things, or he refuses to talk to me about how he's feeling, you can say, well, listen, there is no one right way to cope. And in fact, it's having a range of coping strategies, a balance of coping strategies, and being able to understand why each of you might be using those coping strategies that's helpful. So just because you're coping differently to your partner doesn't mean that they're wrong, or importantly, that they care for you any less. So often I've seen a disconnect between the way couples are coping. So a patient might be coping by really trying to seek reassurance, talk about her feelings, seek reassurance that she's attractive, that she's lovable just the way she is. Her partner might be coping by trying to jolly her along, tell her to keep positive, distract himself, and there might be a number of reasons for that. Often it's in fact because he might be too distressed to talk about difficult topics. But you can see the risks there. One person's really seeking that reassurance, they're becoming upset, the other person's trying to think positively, maybe using more distraction. Inevitably, and this is what happened in this particular couple, this couple was feeling like, I don't think my husband really loves me. I thought he loved me, and now I realise he doesn't. And then she started seeing every interaction, every action through that filter of him not really caring. Whereas in fact the opposite was true. The reason he was coping that way was he cared so much that he was struggling to keep his emotions under control. So helping couples to understand that each of them is likely coping the best they can to deal with that difficult situation. Optimising support, and particularly the support that the patient and partner are offering each other now. This can be surprisingly impactful if you can deal with this well. Now, we know that patient support needs change according to how they feel and the challenges they're facing during that, breast cancer journey. And we know that helplessness in partners, and in fact in patients as well, is probably the most prominent concern. When I ask a partner, what is the thing that's most stressful for you at the moment, they often say, I don't know how to provide support. I don't know what I can do differently. And it's really interesting, because if you can get the couple together or promote a discussion around what they can do to support each other, what you will find is frequently the patient will say, in fact, my partner's doing everything I need him to do. But he didn't know that. And so he was feeling helpless. And what you can then get into is saying, well, what more can your partner do then, given that helplessness is one of his primary concerns? What more can he do? And of course, that opens up a really profitable discussion, because often patients are not asking their partners to do more because they feel like a burden. And in fact, if you can say, well, in fact, what I'm hearing is your partner is saying that he would feel better if you could tell him what to do, what he's doing wrong, or what he could do differently, what he could do more of, not worse. So it can really help. And in fact, what I will do then is I'll go through a list of very common ways of providing support, and I'll give the patient and the partner that list and say, it's a list of maybe 50 things, and say, can you just circle 3 or 4 things that your partner can do for you this week? Given that your support needs this week might change next month, let's just stick to this week. And there'll be things like, tell me that he loves me just the way I am, make me a cup of tea. So a range of practical and emotional support. Help me with the children, talk about things other than cancer, speak positively about the future, tell me how you're feeling, listen to me talk about my feelings. So a range of different ways of providing support. And oftentimes that person is already doing those things, but seeing them circled is incredibly empowering and helps the patient to feel much less helpless. Okay, now this is a biggie. Enhancing communication. Now this, as I talked about earlier, is something that just falls away. That coming together, that knowing each other, inevitably falls away at periods, at least at periods of time during breast cancer treatment. So these are the points that I would cover. I would be really talking about the benefits of talking more honestly about how you're thinking and feeling, and I'd be addressing some of the barriers and pitfalls to communication. And then I would and encourage you, if you could, discuss and demonstrate, how to speak honestly about your thoughts and feelings, and as a listener, how to sit and listen without jumping in and problem solving or telling that person they need to think about something else or think positively about the future. And then I'd recommend scheduling a regular time to come together and talk at least weekly, where all that's on the agenda is, how are you feeling? And the person who's speaking, their job is to simply speak honestly. The person who's listening, their job is to simply listen. Now, with the barriers and pitfalls, I do talk specifically about those because it's those barriers that need to be addressed for people to enable people to talk. And those barriers are, I don't know how I'm thinking and feeling, or they might be, I don't want to upset my partner by talking about the fact that I'm feeling a bit stressed or I'm feeling a bit down, or I don't see that there's a point in talking. I think we should be thinking positively instead. So I really do spend some time addressing those pitfalls, those barriers, and what I do talk about. And if you have the couple there, it's really powerful. I'll talk to the patient and say, okay, so would you say that it makes you feel better that your husband or partner is speaking positively and that he doesn't let you get upset? And they will often say, no, it doesn't. It makes me feel more lonely. Or they might say, I don't feel that I can really talk. I don't feel I have permission to talk about my feelings because he cuts me off or tries to solve my problems too often. Or she might say, I don't want him to talk positively about the future all the time. I know he's stressed. And in fact, if I really knew how he was thinking and feeling, I'd probably worry less. And so it's really powerful to have that conversation because that then opens the way for good communication. And then I will give them communication tips. Talking honestly, but thinking about what it is you want from that conversation with your partner. Don't wait for the right time. It doesn't happen with breast cancer, not with all of the fatigue, treatment, side effects, all the things that you're juggling. So you've got to make a time. It might be Saturday morning, after breakfast, we'll go for a walk. Remove distractions. Really try and, as a partner or as a listener, tune into what your partner is saying and why. Don't try and jump in and solve the problem. The most powerful thing you can do is convey an interest and understanding of what it is that they're saying. Okay, on a more practical level then, moving away from the communication, I will talk to partners, and if I've got them both in the room, couples, about stress management as well. What I find is partners are often not very good at looking after their own stress. They are often spending a lot of time trying to care for their partner, and of course, if they're stressed, or if they're not managing their own stress, and that's just going to add an extra stress to their partner and to the relationship. So I'll talk about different ways that they can, also just good common sense stress management strategies, and their partner will often say, yes, please. And balancing the individual and shared activities. You're more interesting and engaging if you can come back after doing something by yourself and share that with your partner, but neither do you want to do everything by yourself. So balancing individual and shared activities. Okay, and then briefly, and this is a whole topic unto itself, I will look at and talk to couples about ways that they can increase their intimacy. So for women, it's very normal to feel more vulnerable, less physically attractive and desirable during and even after breast cancer treatment, particularly if you've had surgery that's disfiguring, if your libido's gone, if you just feel that you've gained weight as a result of chemotherapy. Now, you often then need that extra emotional and physical reassurance, but sex is often put on the back burner, partly because libido often goes down as a result of chemo, and then perhaps sex might become uncomfortable due to the side effects of hormone treatment or going through premature menopause. So I will spend time and definitely ask the question, what's happened with your sex life and how satisfied are you with that? And talk about the fact that intimacy is much more than sex, and particularly much more than sexual penetration. And we will talk about ways that they can bring that intimacy back into the relationship. Often patients really miss it. They miss being touched. They don't necessarily want sexual intercourse or feel that that's too much, but they want that intimacy, and partners often miss that as well. And there's often lots of specific barriers to that, and I will address them if I can, but it is something that does or is really worthwhile to address, or refer that patient and their partner on to have that addressed if it's something that is causing problems or is not, it's fallen away as a result of going through that breast cancer journey. Okay, well, I think I've covered off on, raced through. I know you slowed down, Denise, but I didn't. Through some tips for promoting couple adjustment. So I don't think really there's much more I can go into without waffling on too much.
You're not waffling, Sam. But I will just sum up some of the things that really took my fancy, and the ones were that you gave people an idea of triggers, because usually when you're in it, it's hard to see it, and so you gave us some really clear ideas of triggers, which for me is feeling lonely, which is what you said, feeling lonely, feeling helpless. And so if we can just make those as the triggers. And then you also gave us some fabulous tips, and the ones that I liked was that list that people can circle each week. That was a great tip. And that the other one was being honest in the communication and listening, that they're skills in themselves. And so I guess if I can just bring it back to us, to what you're talking about today, which is psychology support, and that it actually would benefit people if they're feeling lonely or helpless, to have that outside person. And you can hear from Sam today is that she's not so scary. She sounds like she understands, and being able to sit down and have someone else listen and go through some tips would be a great opportunity. Thanks, Sam.
Thanks, Denise.